Okay, let's continue our visual diagnosis. Dry tonsils, nosebleed, ulcers of the nose, papules of the nose. Dry nostrils. Dry nostrils can be caused either by heat or empty heat, usually affecting the lung or stomach channel. In acute febrile disease, dry nostrils may be caused by toxic heat. And in the beginning stages of respiratory infection, they are caused by invasion of wind heat. Letter A, dryness injuring the lungs. Dry nostrils, a dry throat, dry cough, black nose, itchy nose, dry tongue, false spine on the right front position. Letter B, lung heat, dry and red nostrils, itchy nose, tearing of nostrils, epistaxis, red face, cough, slight breathlessness, feeling of heat, chest ache, thirst, red tongue with yellow coating, and the pulse is overflowing rapid. That is lung heat. Okay, letter C, stomach heat, dry and red nostrils, epistaxis, crust around the nostrils, burning, epigastric pain, thirst, sour, regurgitation, nausea, excessive hunger, foul breath, a feeling of heat, red tongue with yellow coating, and the pulse is overflowing rapid. Okay, letter D, lung yin deficiency with empty heat. Dry nostrils, itchy nose, dry cough or with scanty, sticky sputum that may be blood tinged, dry mouth, and throat at night, weak or hoarse voice, night sweating, tiredness, malar flash, a feeling of heat or a low-grade fever in the evening, 5-pound heat, thin body or thin chest, insomnia, anxiety, red tongue without coating, and the pulse is floating empty and rapid. Okay, letter E, stomach yin deficiency with empty heat. Dry nostrils, dry mouth and throat, especially in the afternoon. Dull or burning gastric pain, feeling of heat in the afternoon. Thirst with desire to drink in the small sips. Dry stools, slight feeling of fullness after eating. Night sweating, 5-palm heat, bleeding gums, red tongue, or red center only, without coating in the center. And the pulse is floating and empty, floating empty and rapid. Okay, letter F, lung and Spleen-Qi deficiency. Dry and itchy nostrils, dry crust on the nostrils, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity, slight shortness of breath, slight cough, weak voice, spontaneous daytime sweating, dislike to speak, propensity to catching colds, dislike of cold, with pale tongue, and empty pulse, especially on the right side. Okay, letter G, blood stasis. Dry nostrils, dry nose bridge, thirst without desire to swallow, headache, dark rings under the eyes, purple tongue. This blood stasis. Letter H, invasion of wind heat. Dry nostrils, again, acute onset, aversion to cold, fever, cough, sore throat, stuffed or runny nose with yellow discharge, headache, body ache, slight sweating, slight thirst, swollen tonsils, tongue, slightly red on the sides in the chest area or on the part on the front part, and the pulse is floating rapid. Letter I, invasion of wind dryness. Dry nostrils, acute onset, dry cough, dry throat, aversion to cold, fever, dry throat, tickly throat, dry nose, discomfort of chest, thin dry white tongue coating, and the pulse is floating. Letter J, toxic heat in the lungs. Dry nostrils, swollen and red nose, flaring of nostrils, cough with expectoration of blood sputum, fever, chest pain, mental restlessness, cough, breathlessness, feeling of heat, thirst, red face, red tongue with red points in the front of the teeth, front and teeth, sticky, dry, dark, dark yellow coating, and the pulse is overflowing, slippery, rapid. Nosebleed. The two main cause of nosebleed, as in other forms of bleeding, are heat agitating the blood or deficient Qi, unable to hold blood. In the case of nosebleed, the organs most frequently involved are liver, stomach, and lungs, with also with pattern of heat, or spleen, deficient Spleen-Qi, not holding the blood. Acute nosebleed may be caused by invasion of wind heat. Okay, letter A, liver fire insulting the lungs. Nosebleed often induced by emotional stress. Bloodshot eyes, breathlessness, asthma, or feeling of fullness and distension of the chest, and hypochondrium, cough with a yellow or blood-tinged sputum. Headache, dizziness, red face, thirst, bitter taste, scanty dark urine, constipation, red tongue with redder sides and dry yellow coating. And the pulse is wiry. Okay, letter B, acute lung heat. Nosebleed, flapping of Elinese, flaring of nostrils, red face, cough, slight breathlessness, feeling of heat, chest ache, thirst, red tongue with yellow coating, and the pulse is overflowing rapid. Letter C, Spleen-Qi deficiency. Chronic nosebleed with the pale blood, often induced by overwork, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity, and the tongue is pale, and the pulse is empty. Okay, letter D, stomach fire, nosebleed with dark red blood, red nose, bleeding gums, burning epigastric pain, intense thirst with desire to drink cold liquids, mental restlessness, dry mouth, mouth ulcers, bleeding gums, dry stools, sour regurgitation, cold breath, nausea, vomiting soon after eating, a feeling of heat, sour regurgitation, tongue red with thick, dry, dark yellow coating, deep and deep full rapid, the pulse. Letter E, kidney yin deficiency with empty heat. Chronic nosebleed with scanty bleeding, dizziness, tinnitus, vertigo, poor memory, hardness of hearing, night sweating, dry mouth at night, 5-pound heat, a feeling of heat in the evening, Muller flash, menopausal hot flashes, thirst with desire to sip fluids, lower back ache, ache in bones, nocturnal emission with dreams, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, depression, excuse me, anxiety, insomnia, excessive menstrual bleeding, red tongue without coating, and the pulse is floating, empty, and rapid. Okay, letter F, liver blood stasis. Nosebleed with the dark blood, which may be associated with the period in women. Dark bridge of the nose, headache, hypochondrial and abdominal pain, painful periods, menstrual blood dark and clotted, masses in the abdomen, purple nails in lips, purple or dark complexion, and the tongue is purple, and the pulse is wiry or pear. Letter G, invasion of wind heat. Nosebleed, aversion to cold, fever, cough, sore throat, stuff or runny nose with yellow discharge, headache, body ache, slight sweating, slight thirst, swollen tonsils, tongue, slightly red on the sides in the chest area or front part, and the pulse is floating rapid. Letter H, residual dry heat in the lung. Okay, slight nosebleed, dry cough, feeling of heat, dry throat, chest pain, tongue red in the front and dry, and the pulse is overflowing, empty, and rapid. Okay, letter I, collapse of both yin and yang. Profuse, unstoppable nosebleed, bleeding gums, macules, blood in the urine, profuse sweating, like oily beads, ashen gray face, mouth open, cold limbs, hands open, incontinence of urine, unconsciousness, weak breathing, pale short tongue, and the pulse is scattered minute. Okay, clinical note. The Shickley points are good to stop bleeding. In the case of the nose, lung 6 is applicable. Ulcers on the nose. Ulcers on the nose are usually due either to lung heat or damp heat in the stomach and spleen. Okay, letter A, lung heat. Ulcers on the nose, red nose, dry nose, cough, slight breathlessness, feeling of heat, chest ache, flaring of nostrils, thirst, red face, red tongue with yellow coating, and the pulse is overflowing rapid. Okay, letter B, damp heat in the stomach and spleen. Ulcers on the nose, swelling of the nose, sticky taste, a feeling of fullness and pain of the epigastrium and lower abdomen. Poor appetite, a feeling of heaviness, thirst without desire to drink, nausea, loose stools without offensive odor, a feeling of heat, dull yellow complexion, sticky taste, red tongue with sticky yellow coating, and the pulse is slippery, rapid. Letter C, liver fire. Ulcers on the bridge of the nose, red bridge on the nose, headache with red face, dizziness, tinnitus, irritability, propensity to outbursts of anger, thirst, bitter taste, constipation, dark urine, red tongue with redder sides, and dry yellow coating. And the pulse is wiry, rapid. That is liver fire. Okay, letter D, toxic heat in the liver. Ulcers on the bridge of the nose pain, red and swollen nose, fever, red face, macular eruptions, agitation, headache, dizziness, tinnitus, irritability, propensity to outburst of anger, thirst, bitter taste, constipation, dark urine, red tongue with red points. And the tongue is thick, sticky, dry, dark, yellow coating. And the pulse is overflowing, slippery, rapid. Is toxic heat in the liver. Okay. Papules on the nose. Red papules on the nose may indicate stomach heat, lung heat, or if they are dark, that is blood heat in the lung. Okay. Letter A, stomach heat. Papules on the nose, burning, epigastric pain, thirst, sour regurgitation, nausea, excessive hunger, foul breath, a feeling of heat, red tongue with a yellow coating, and the pulse is overflowing rapid. Okay, letter B, lung heat. Papules on the nose, cough, slight breathlessness, feeling of heat, chest ache, flaring of nostrils, thirst, red face, and the tongue is red tongue with yellow coating, and the pulse is overflowing rapid. Okay, letter C, blood heat in the lung. Dark papules on the nose, cough, coughing of blood, slight breathlessness, feeling of heat, chest ache, flaring of nostrils, thirst, red face, red tongue without coating. And the pulse is overflowing rapid. Thank you for your attention, everyone.